Hi, and welcome to the tutorial video for the deep tissue roller. We're going to start with hip flexors, the superficial ones and the quadriceps right here, front of the thigh. We're going to move into TFL and do a little bit of hip work. We're going to do a little bit of adductor work as well. And then the next step is we move that into the Psoas. The way that normally I work as a body worker on people, I've been in practice for 25 years, is you start with the superficial muscles first before you move to the deepest thing. The deepest thing we're going to be doing today is the Psoas and the Iliacus, and these are deep lying muscles that reside inside the pelvic bowl here, deep to your abdominals, to the side, and we'll go over contraindications and how to do that safely, as well as the technique with the roller. So to start, we're going to do work on the quadricep. So there's a couple of endangerment sites in the hip that you want to be aware of. There's the hip crease here. That has something called the inguinal ligament on it. You're not supposed to put direct pressure on it. So it's this direct seam you would see between the leg and the pelvis. It starts at the little knob here of the hip, the bone. It's called the anterior inferior iliac spine. And it goes across to the pubic bone. So your pubic bone is this solid bone here. It sits right above the penis in men. It's right above the vagina in women. You can feel the bone there. There's a little patch of fat usually on top of it. And then off that bone is these, either side is the inguinal ligament. We're gonna avoid the inguinal ligament. When we start working on the abdominals, we wanna be conscientious of generally above the belly button is not ideal. You don't want to be on the lower ribs because the lower ribs are made of cartilage, so they are easy to damage. So we want to avoid lower ribs. More importantly, though, deep to this space is the kidneys. We don't want to put any pressure on the kidneys. This will show up as sharp pain. You can just look for that in your body. Avoid that. We're looking for kind of a dull ache sensation. We want to avoid sharp pain, numbness, tingling. These are all contraindications. If you feel them, you should lighten up, you should stop what you're doing, you should reassess and make sure you're not on any of these endangerment points. So that being said, we're going to start with the quadricep. So I'm going to have the roller, I'm going to separate it just a little bit because my quadricep is wide, so even a little bit more than that for my quad. So we're going to bring it to this position. That's probably the right amount of separation. And then I'm going to put my weight on it. So I'm going to lay on the ground. We can go sideways so you can see what I'm doing here. Lay on the ground. I'm going to put this on these blades of the roller on either side of my quadricep. Just like that. It's super simple. So I can lay here like this, and if I can let my body relax, I can allow my weight to drop into the device. When my weight drops into the device, I can feel it on either side of the quadricep. If I want to increase that pressure, I can bring my leg up and just try to balance it up here without any stress in it. If I want to hold my leg, I can hold my leg. For some people, that might be easier than balancing it in order to let go of the musculature in the front of the thigh. So you want to be able to relax onto the device whenever you're using the device. I don't want to be engaging these muscles as much as possible in order to address deeper layers of myofascia in the leg. So if I want to penetrate all the way to the bone where the muscles, tendons, and fascia begin, I need to have those superficial layers relaxed while I'm working. So I can do that by breathing, by paying attention to my breath. So I'm going to lift my body up off the ground here in order to increase the pressure even further. And then if I really want to go crazy, I can hook my foot of the opposite leg onto this leg, and I can lift in this case, my right leg off the ground a little bit. Now all my weight is poured into that. That is intense. It's probably more than I need. For me, just being up on my elbows and having my pelvis off the ground is enough for me to feel like I'm getting deep work. We don't need to overdo it. You just want to feel like those deepest levels are being addressed so you can have an opportunity to relax those deeper levels. So every time we're working on this area, if you're going to move very slowly. And then if you find a good spot, you want to just stay on the spot. 20 seconds on a spot allows the muscles to relax, up to 2 minutes for the fascia. So you want to take your time here. You should feel the fascia relax. You're going to get a sense of that happening the more you use the device. It's like a big sheet across the whole leg, just sort of like softens. And that makes the device go deeper. Your muscle can relax is the first layer, and then the second layer is the fascial sheet that surrounds the muscles, bones, and organs. This fascial sheet is more of a passive structure. It takes longer to release, and you just want to wait for that to happen. So 20 seconds to 2 minutes is the window. I'm going to move faster than that here, just so that you're not bored. So the other way that we can address the quadricep is on the side of the body. So this is also the IT band and hip work. So I'm going to go down to the quadricep space, which is here in the thigh. Now you'll notice me adjusting the edges of the roller, right? Because the roller, if it's the blades of the roller are pinched too far in, that's going to be too intense for me. Some people may prefer that because it will target an area better. I'm going to widen them just enough so that I'm feeling comfortable. So right now they're at a really comfortable place for me. I'm being cradled in between the two blades of the roller, as opposed to earlier they were going this direction. And for me, that's just too much. Like if I was doing a lot of work, or if I didn't have as much tone in my body or whatever it is, that might be comfortable and I might want that deep penetrating feeling. For me, I want those blades a little bit wider because I need to be able to relax on the device. So again, here I'm going to try to let my knee relax. So your kneecap is a good way to gauge if your quadricep is engaged or not. If my kneecap is raised up like this, ow, that hurts. I want to let it drop down toward my leg, toward my foot, I should say, in order to relax that muscle and again do the deeper work in the thigh. Right now I'm also addressing the hamstring in the back, but the vastus lateralis, the furthest lateral, the furthest to the outside quadricep wraps around the leg and attaches underneath. Some anatomy books say that it doesn't do this, but my experience is oftentimes that is definitely something that needs to be worked on in order to thoroughly work on the quadricep. Everyone's body's a little bit different. I am guessing that the difference in some anatomy books is that some people don't have that anatomy and the quadricep, vastus lateralis, just straps down to the knee. But regardless, this is a good area to work on and it is related to the quadricep. So I'm going to sit here again. We're going to find a sore spot and I'm going to sit for 20 seconds to 2 minutes. I'm going to try to relax on it. My knee keeps trying to relax or trying to engage, so I have to remind myself to relax by breathing into the area. If we move that up, again, we're going to move slowly when we're moving, and when you find a good spot, you want to just take your time. And as you move up or down with this, these blades again might get a little bit out of place, so you can just adjust them with your hand. Usually for me, it's like a 1/4 of an inch adjustment, makes a huge difference. So as I get higher up here, there's another hip flexor called the tensor fasciae lata, or the TFL, and it sits right above here. So there's my hip joint, my hip bone here, and I'm on the inside of the hip bone. On the inside of the hip bone is that TFL. Again, we don't want to be on the outside too much because we want to avoid that inguinal ligament in the inguinal crease of the hip. But right now, that inguinal ligament is here, and then my hip bone is here, and I'm on the back side of that hip bone. There's a fleshy bit there. I'll throw up some anatomy charts so you can make a little bit more sense of it. But right here, I'm gonna just relax. If I bring my leg back, I'm gonna lengthen that muscle. That feels kind of good. You can just kind of go through different movements. Another good movement is a reaching down and out of the heel of my, in this case, it's my right leg. So I'm gonna reach down and out of the heel, try to make space for the hip joint. I can move it forward, which starts to lengthen my gluteal muscle in the back. These are all related to hip flexor stuff usually for most people, so it's a good place to work on. I'm just gonna kind of move up and down and find some more. Oh, that's a good, delicious spot. So I'm looking for a dull ache, a little bit of soreness, and something that feels good, even though it might be intense. You know, this is a high level of sensation that we're looking for here without the body's retraction because of too much pain. So how do you sit in that level of sensation in a relaxed way where you can breathe into it and you can allow your body to receive the work? That's the most important thing anytime you're using any kind of self-myofascial release device, but the deep tissue roller is no exception. So these are all great areas. Oof. Now the next one I want to show you, which is a little harder to show on video, is I'm going to shorten my device just a little bit, and I want to be getting into the adductor group. So that's in here. The way that I'm going to do that, and this just depends on how much flexibility you have, the way that you can do this, is I'm going to be here and I'm going to be laying on the device this way. So that's the position. and all I'm doing is relaxing onto the device. If you don't have enough flexibility in your hip here, if your hip doesn't open up enough to give you access to this area, so for me, I can just roll my hip down and back, find a good spot. Again, I can lift my body up if I want to increase the sensation, and I'm avoiding that inguinal ligament again in this area. This area, it feels like it's not that dangerous, but that's just probably related to my flexibility. Now, if you have less flexibility than this, you might want to get creative with the way that you're doing the work. One creative way to do this would be to put the device up on a block. Let's see where mine is. Well, I don't know where my block is, but oh, I got this. I'm going to use this. This is like a firm pillow. This is a Zafu used for medication. So I'm going to use this. I'm going to put my leg up onto this in order to address that adductor region without needing as much hip flexibility. You can see right where I'm at there. Oh, this feels really great. And this actually addresses a slightly different part of the adductors right now. So, you know, I'm using this pillow. This is full of buckwheat, so it's a pretty firm pillow. You could use anything. You could use a yoga block. Probably 2 yoga blocks are a good way to set the roller up to give you a little bit more space. But, you know, get creative with whatever you have around the house and just something that it can sit on. So again, I can do this movement here. I can even reach down and out of the heel of my foot as I'm here. That feels really good. Helps to release that muscle. I can move back and forth. And the whole time I'm doing all of these movements, I'm trying to allow my leg to stay relaxed in order that I don't engage these muscles underneath. I want to feel like when I'm moving the leg, I'm just dragging the heel on the ground so that I'm not lifting it and engaging musculature in my leg. And then if I'm going to do a reach, I'm still keeping the heel dragged on the ground, but I'm reaching the heel down in order to make space for my hip. All right. We've gone through all the prep work for the hip flexor. And I hope you've taken your time with this. Again, 20 seconds to 2 minutes in every spot. Make sure that you're really spending the time that you need in order to get your fascia to release before you move on to the next step. It's very important. And the next step is going to be the Psoas. So this device, you know, there's other devices on the market that are a little bit more pointed than this device. And those are fine, but that's really isolated to the deepest level of work. This is a safer device. It's more rounded. It's softer, so it's going to be harder to get like to your kidney, for instance, which is kind of the big risk with doing any kind of Psoas work. So again, I'm going to go over the landmarks and where to stay. So the upper landmark of where the device should be is my belly button. People have different belly buttons. I mean, they're like some are higher and some are lower. It's kind of a general statement. The bottom of the ribs is also another thing to be aware of. So we're going to try to be below that. And then the hip crease, again, is right here, the inguinal ligament, so we want to be above that. So I'm going to be somewhere like right here. So on my hips, you can see, I'm somewhere right in here. I've got this hip bone is on in between the device. The outside of the device is on my TFL, which is the outside of the hip bone. The inside of the device is on the inside of the hip bone. It's cupping the hip. I have pretty high hips because I'm a male. Women have a little bit shorter hips, so you're going to be a little bit above the hip bone. But for me, I'm just on either side of the hip bone. And what I'm going to do is I'm just going to lay it on the ground, and I am going to allow my body to relax over the device. And because of the way this device works, it's a wedge. So as I put pressure on it, these wedges will cause a leveraging action, which will pinch my hip bone. This is the ideal vector for working on Psoas and Iliacus stuff. So this Psoas and Iliacus, the Psoas attaches to the front of the spine here, goes through the inside of the hip and attaches to the inside of the leg here. The Iliacus attaches to the iliac bone, which is this big hip bone here, and it attaches at it's got the same point of attachment on the lesser trochanter of the femur as the Psoas. So there's 2 heads to effectively one muscle. Some call it the iliopsoas for that reason. Now, I've got fairly flexible shorts on, but I am going to loosen them up and lower them a little bit so that it is easier for me to get to this area. Especially if you have a belt or like jeans on, you really want to maybe unbutton the jeans and give yourself a little bit more availability there. So my hip is here, I'm laying here, and I'm just going to find that place. And we want to be really aware of like the sharp pain feelings here, making sure that we're not in the wrong spot, making sure we're not putting weight on that inguinal crease or on your soft lower ribs, or false ribs as they call them, because they aren't bones, they're made of cartilage. So we want to be gentle with those soft ribs. And I'm just gonna sit here. This feels really good, just laying here. Again, these are similar movements as to what we were doing with the quadriceps. I can bring the leg up if I want. That kind of makes a difference. It's much more mild than the quadriceps though. And then I can rotate the leg in and out. So the direction the psoas rotates the leg is lateral rotation. So you can see this as laterally rotated knees, meaning that your knees are pointed out when you're in a standing position versus pointed forward. That would possibly indicate psoas tension. In order to lengthen the psoas, we want the leg to rotate medially, which is this way to the outside. So that's lengthening the psoas. I can kind of like move through that range of motion. I want it to be easy. I don't want to force it, because if I force it, I'm going to be engaging the muscle here that I'm trying to work on, and that's not going to be productive. So I can also do this movement where I'm reaching down and out of the heel. Here, I'm just keeping my toes on the ground so that I'm not lifting my leg up, and I'm reaching all the way from the hip out the heel. Here, I'm kind of reaching out of the toes, I guess, because my toes are pointed. But the idea is that the whole hip is reaching. You see my whole hip reaching from all the way from up here. And that's a way to deepen the work. So I would do some of those reaches slowly, coming in and out of the reach. And then I would just take a moment to relax and allow my roller to do its work. So again, this is a 20 seconds to 2 minutes relaxation here. So I'm going to wait for at least 20 seconds before I start doing maybe a little reaching again. We can do windshield wipers with both legs if you want. That's an interesting way to deepen it. And if there's a spot like right there, that's a great spot that feels like it's doing something, it feels deeper, then just hang out there, you know? All of these different movements are ways to explore how to deepen the work. So we really just want to feel the sensation in our body where we're working, and we want to try to feel for where that might be intensified, and again, in a healthy way. We don't want to have the sharp pain or the tingling or any of those other sensations I mentioned earlier, but we do want to deepen the sensation. So if we have increased sensation, increased intensity, that's positive as long as we don't go over that line. You know, the intensity should always have a seed of pleasure in it. So look for the pleasure with the intensity and follow that with these movements. Again, I can bring my body up off, and that's going to intensify it for sure. I can move up and down just a little bit. I don't want to go too far up, but that feels great right there. And then I can just let my pelvis relax. So right now I feel my right hip is dropping. Watch my hip. It's the opposite hip. It's dropping into the floor. As it drops into the floor, the pressure from the device moves more towards the inside of my pelvic bowl, which is targeting the psoas. And you want to move slowly here. You know, my hip might start up like this, and part of that might be just because my abdominal muscles aren't relaxed, right? My abs aren't relaxed, so it's going to take a minute for my abs to relax. A little bit of movement can help. Just sitting here can help. You know, just sitting here for that 20 seconds can really just help to soften everything. As long as you're relaxed and paying attention to your breathing, it can really, really be beneficial. So take your time. You can do that on both sides. I showed the left side today, but both sides are relevant. And, you know, let me know how it goes. Again, feel for any sharp pain, you know, especially when we're around the abdomen. We can have gas pains, which feels like a sharp pain, so that's not going to be helpful. It's not going to allow you to feel relaxed. We want to avoid that. Yeah, listen to your body, and let me know if you got any feedback for me. I would love to help clarify this work for anyone that needs it. This is really helpful work for people with hip flexor tension, which is a lot of people. Deep tissue roller. You can find me online at deeptissueroller.com, on Amazon, on social media, Instagram, TikTok, what else? Facebook, yeah, all those. On YouTube, you can find my tutorial videos like this one. There's tutorials for the entire body. Just search for deep tissue roller and look for the tutorial video playlist. All right, thanks so much.